This hour of the Howie Carr Show is brought to you in part by Piantadosi Baking Company, celebrating 100 years of baking excellence since 1916. And joining us now on the line is Dr. Peter Q. Warinner, MD, and he's the author of a new book. It's a really great book on American. Here, he's holding it up right now. If you're watching us on Newsmax or on the Howie Cam, The Art of American Healthcare. Peter Q. Warinner and MD, and you can order it on Amazon.com. And the last time you were with us, Doctor, it appeared that Donald Trump was going to lose the election, and we were all going to be stuck with Obamacare for the rest of our shortened lives because we were going to get such reduced medical care. Now Donald Trump is in office. He's pledged to repeal Obamacare as probably job one. Are things looking up now for the art of American healthcare?
Oh, I think so. I think he must have read my book because one of the many proposals I have in the book is to appoint someone to be Secretary of HHS that is actually an MD, not just an MD, but an MD with clinical practice. So Tom Price has been a surgeon in private practice for over 20 years before he went into Congress for over the past decade. So I think he's the absolute perfect choice. So I'm very optimistic about that choice.
Tom Price, of course, is the congressman from Georgia, and he's going to be the next Secretary of Health and Human Services, and he's going to be the one that's going to be in charge of winding down Obamacare. Isn't it strange, Dr. Warinner, that the Democrats, they were so wedded to this? All of them used to say this was the best vote they ever made, and this was the vote they were proudest of. And now, the silence is deafening. They don't seem to be putting up much of a fight here as all of the Republicans, McConnell in the Senate, Ryan in the House, and Donald Trump and Dr. Price, they all agree this is the first thing they're going to get rid of. And again, they're not putting up, they don't seem to be putting up much of a fight.
Well, I tend to give people the benefit of the doubt, and I think things were perhaps in some cases done with the best of intentions and maybe with a little bit of ignorance, though, because I think this needs to, healthcare needs to be decided by clinical medical doctors guiding the decisions, not advising politicians and lawyers and lobbyists in Washington, and I think that's about what's going to happen. But getting back to repealing and replacing Obamacare, I believe, and I think most of my colleagues would agree, and perhaps most patients if they fully understand what's going on, that it's important to completely repeal Obamacare first without necessarily combining it into one massive legislation of a repeal and replace. So just get rid of it first. It was an absolute myth that we ever needed it in the first place. It's just, we never needed it. It was nothing more than government's attempt to take over the healthcare industry and try to control doctors in their exam rooms and what they do with patients.
But the problem, Doctor, is if they just repeal it flat out, you know what it's going to happen. There's going to be a million sob stories in all of the mainstream media about little Joey Smith, who has a congenital heart defect, and now he's lost his coverage. I mean, I don't even know if the Republicans, even as big as their majorities are across the land, are willing to undergo that kind of negative blitz of PR.
See, I disagree. There may be stories like that are in the media, but I'm not so sure there'll be real life stories that have any credibility. Doctors and hospitals are far better than that. And at any point in time, regardless of governmental influence or regulations or legislation or not, doctors and hospitals always, particularly in America, take care of patients. So when people years ago, before Obamacare, before insurance was ever invented, doctors took care of patients. And I know myself and pretty much every single doctor I've ever met or interacted with would see patients for free, even perform surgical procedures for free. So people are not going to be lacking in medical care. And so Obamacare is about health care insurance. It's not about health care. Doctors and hospitals provide health care, and they always have, and they always will.
Yeah, there have been Supreme Court decisions. I think we've discussed it in the past that nobody can be turned away under law from an emergency room. Correct?
Absolutely, but forget about the laws. Doctors just don't think that way. We take care of people. We don't worry about, most doctors don't even know what's being charged. It's often left to the administrative staff in their practices or at their hospitals. Doctors just want to take care of people.